Hello all, I am Dr. Ashwini Kulkarni, Consultant Psychiatrist, Pune. So today I would be talking on adult ADHD. So today in this video, let us try to understand what is ADHD, what are the symptoms of ADHD, and how frequent or how common is ADHD seen, how is it being misdiagnosed, when to seek help, and what are the help available to treat ADHD. So what is ADHD? The ADHD full form is Attention Deficit Hyperactivity Disorder. As the name itself has, there is lack of attention, that is inattentiveness, there is hyperactivity, and third is impulsivity. So there are three types of ADHD. One is inattentive type, second one is hyperactivity impulsive type, and third is a combination of all three: inattentiveness, hyperactivity, and impulsivity. Now let us try to understand how common or what is the prevalence rate. Usually the adult ADHD in the current situation is around 4% of the population, but definitely because it is usually not diagnosed in the childhood, or it is being misdiagnosed, or it is missed during the childhood, the symptoms are prolonged in the adulthood. So definitely the rate could be higher than 4%. So let's try to understand what are the symptoms of ADHD. In the first part of inattentiveness, an individual is not able to pay attention into details. They make careless mistakes and they lose things easily. They are not a good listener, and so they feel they are forgetting things, or there is part of forgetfulness. They avoid the task that needs a sustained effort or a longer attention period, and they get distracted easily in those activities. The second part is hyperactivity and impulsivity. So in hyperactivity, as the word means, is one, they're not able to sit at one place. They would be constantly moving, fidgeting, they would be leaving the place, they're not able to wait for their turn. And the part of impulsive is they would blurt out the answer, they would want to react immediately. And so when there is a combination of both inattentiveness and hyperactivity impulsivity, comes the combined type. So let us try to understand what are the impacts of ADHD in individual's life. First is in academics. One, because of the inattentiveness or loss of concentration, there is difficulty in completion of assignments, missing on the deadlines. There is underachievement, because of which there is a lot of bullying which is seen in the school and colleges. And this leads to loss of confidence and a social withdrawal, and a lot of anxiety which is already seen in children and adolescents during that phase. Next, at workplace, because of missing on the deadlines, there is incompletion of the projects. They forget of important details, and that leads to a lot of carelessness. And this also affects their productivity and performance at work. The third part is definitely there is a risk of substance use. There is increase in risk of drug use like alcohol and other kind of addictions because of the impulsive behavior. Because there is a lot of hyperactivity that is seen, there is increase in risk-taking behavior, rash driving, and increase in risk of accidents. And this also impacts the relationship and leads to, because of the procrastination part, living on their responsibilities, definitely impacts all kind of relationship in the house, family members, at workplace, and with friends. So as I mentioned, that ADHD is usually diagnosed in the childhood, but if they are missed or misdiagnosed in the childhood, 80% of the prevalence is also seen extending into the adolescent and the adulthood. Definitely the hyperactivity part decreases when they are progressing into adolescence and adulthood, but inattentiveness worsens in the adulthood. But now there are other comorbidities which is also seen in ADHD. One is anxiety part, because as I mentioned, there is hyperactivity, constant fidgeting, and because of how it has affected them in their academics, underachievements, poor performance, definitely leads to socially withdrawn, social anxiety is seen. And there is next component which is called depression. Depression, definitely the patients initially come to me and they are stating with all the depressive symptoms when they are presenting at the age of 25 or 28. But when I start taking a detailed history, then I'm able to trace that the symptoms have started much before, even during their childhood, but that was missed. And today the person is presenting with depression because it is affecting them, as I mentioned, in the areas of work, in their performance, which is affecting their ability. They are questioning, they are doubting their own performance, and affecting the relationship. There is a part of bipolarity where there are a lot of mood swings, irritability, which is also seen with ADHD. If left untreated, then it leads to other kind of disorders of addictions and other kind of abuses. So definitely there is a treatment when it is diagnosed in the early age, and there are scales to identify this ADHD. This video is very much important for spreading the awareness, because people usually see that the person, the child or the adolescent is just not showing interest in their studies, avoiding or do not want to perform, and that further impacts that individual. So we need to spread the awareness that we need to identify this component so that an individual can be identified at the early stage, helped, and will find the progress in life. So what are the treatment of ADHD? In the treatment of ADHD, as I told you, first is identifying the severity and the type of ADHD. There are scales and there is a detailed history which your psychiatrist or the psychologist would be taking. And second part is the treatment, which would be one with the medications. Second is the therapy part. The attention focused therapies are there. There is mindfulness, the cognitive behavioral therapies definitely helps. The treatment would also include taking care of other comorbidities like anxiety, depression, bipolarity, and the addiction part. So now it is very important we all understand that yes, ADHD can be taken care of. Yes, the individual can perform better and can become successful in life if identified rightly and taken help at the right time. So let's spread this awareness to seek help at the right time. Thank you.